Have you ever seen someone like this? They not crying, but their eyes are always full of tears with sticky discharge at the corners? It's not being overly emotional. It's a traffic jam in their tear duct. Today, let's talk about what a blocked tear duct is. So, what is a blocked tear duct? The tear duct is the passage that drains tears from the surface of the eye down into the nose. When any part of this passage gets narrowed or blocked, tears can't drain properly. This leads to constant tearing, what we call epiphora, or watery eyes, along with increased eye discharge, and sometimes even a secondary infection of the tear sac called dacryocystitis. That's a blocked tear duct. Who needs an amniotic membrane stent? For patients with chronic blocked tear ducts that don't respond to conservative treatment, like after repeated probing or antibiotic therapy, they still have constant tearing. An amniotic membrane stent can be considered. It's especially suitable for people whose blockage is in the nasolacrimal duct and who don't want or can't have traditional dacryocystostomy, an open surgery that requires a skin incision on the face. The advantage of an amniotic membrane stent is that amniotic tissue naturally has anti-inflammatory, anti-scarring, and epithelial healing properties. Here are the surgical steps. The procedure is done under local anesthesia and takes about 10 to 15 minutes. First step, ablation procedure. The doctor first dilates the punctum, then inserts a thin optical fiber or ablation probe through the upper or lower punctum, advancing it all the way down to the blocked area of the tear duct. Using the heat generated by laser or radiofrequency, the doctor precisely ablates the overgrown tissue, or scar tissue, that's causing the blockage, reopening the passage. The ablation is performed under direct vision, or with the help of an endoscope, making it extremely minimally invasive, with very little bleeding. Second step, confirming the position and flushing. A little saline is injected through the punctum to see if it flows smoothly into the nose. If the flush goes through easily, that means the blockage has been cleared and the tear duct is now open. Third step, introducing the amniotic membrane stent. The stent, which is rolled into a thin strip, is pushed along a guide wire or directly advanced to the nasolacrimal duct area. Under X-ray or endoscopic guidance, the stent is accurately positioned and then released. It unrolls naturally and supports the duct wall, preventing it from narrowing again after surgery. If you or someone around you always has watery eyes for no clear reason and you just can't wipe them dry, why not visit a doctor and ask if the tear duct is blocked and whether this minimally invasive stent might be a good fit? After all, when your eyes aren't constantly tearing up, seeing the world is a lot clearer and more comfortable, don't you think?